My very first bariatric procedure was back in 2001. It was performed in conjunction with Dr. Wynn, my associate. She and I are actually the ones who started bariatric surgery in its present modern form in our area. As far as I can remember, I've always wanted to be a physician, a doctor. I think in part that has to do with the fact that my uncle, who used to live with us, was always sick. In fact, he had, in his 20s, he had undergone about 2 or 3 operations, I remember. And I used to go with my mom to see him in the hospital, and that I was exposed to the doctors, particularly the surgeons who operated on him. And that really made it. I wanted to be a surgeon. In medical school, one of the very first rotations I had was in surgery. And when I saw a surgeon suturing 2 pieces of the intestine with such delicacy and accuracy, I knew I wanted to become a general surgeon. I think the thing I like most about being a doctor is the privilege of being allowed to enter into other people's very intimate life. A patient that comes to my practice as a new patient, somebody I have never met before, will be sitting down in my office, and during that very first encounter, they will be trusting me enough to tell me very intimate issues about their life that are going to be very relevant in helping them with their medical problems. One of my routines had been actually to swim very early in the morning, and in the gym I used to go to, that was perfect time because the lanes were almost always empty. It was great. So before the pandemic, that was my routine for a couple of years, to just go swim and then go to work, which means making rounds in the hospitals if that's necessary. If not, go to the office to see patients if it's office hours, or if it's a surgery day, I would go to the surgery center or to the hospital to perform surgeries. And in between that, obviously, messages will come from my kids that are now at an age where they think they can text me at any time about any issues. And of course, that's part of my job as a dad, and I do that as well. Actually, there are 2 favorite parts of my day, okay? One is in the office with patients, and I love to listen to patients and seeing how relieved they are. Actually, by just talking and having a doctor listening to them just makes me very, very happy. So I look forward to that. And then the other part that I look forward to is performing surgery, particularly minimally invasive surgery. Is one of my favorite types of surgery, where particularly there is complex suturing and maneuvering that needs to be done, that I love doing in the operating room as well. A privilege to be a physician. It's one of the very few professions, as I said, where you can see directly the impact of your work in a positive way on somebody who needs help, and I feel privileged that in my life I am able to do so, and I would love to do it as long as I can.